Hello, everyone. Academics, ex-academics, Altax. This is Özgün Ünver from Mind Your Own Revisions. And today is day 21 of the 30 days, 30 tips challenge for me to give you tips to prevent and overcome burnout as an academic. So today we are talking about the difference between burnout and depression. And burnout and depression, in fact, are quite different things, though many people think that it's somehow related. The one most important connecting point between the two is the depressed mood. But other than that, depression is a mental illness. It's a diagnosable mental health illness, but burnout is not only about your mental health. So unfortunately, many people, including some healthcare professionals who are not knowledgeable enough about burnout, dismiss burnout as depression. Though burnout is an energy disorder, though depression is a mood disorder, right? I'm talking about the clinical depression here. The trickiest thing, as I said, is it's a depressed mood. It's normal that in burnout you have depressed mood. It is one of the features, let's say, one of the signs and symptoms of burnout, though you are not necessarily supposed to be clinically depressed when you have burnout, or in order to be diagnosed with burnout either. Having said that, know that the only person who can diagnose you with one or the other is a physician or a mental health professional. So please seek out diagnosis if you are wondering, oh, am I depressed? Am I burnt out? Or what is going on? The thing is, depression needs to be treated with therapy and or medication or a combination of both, right? And only medical professionals can do that, and clinical psychologists and psychiatrists can do that. While if you're experiencing only burnout without depression, coaching is usually sufficient to come back to a state of well-being. Though depression and burnout can indeed occur together. So that's also one of the tricky parts. This is what we call complex burnout. And again, this needs to be also treated by medical professionals, psychiatrists, clinical psychologists, and the like. Coaches are not trained mental health care professionals, and they're not equipped to treat mental illness, as I said. Though therapy and coaching can go very well together. So they can be very complementary, but as a coach, for instance, my requirement is that my client comes to me within the knowledge of their physician and their therapist, so that everyone helping this person is aware of the other types of support this person is getting, and if necessary, a division of labor can be made, right? So there you go. This is a tip of the day for you. Burnout and clinical depression are two different things, but they can occur together. And in each of these scenarios, you will need to go through a different route to come back to a state of well-being. If you are serious about preventing or overcoming burnout as an academic, please do join the Bounce Back from Burnout, starting from 30th of January 2022, if you're listening to this video before that date. For the second time, Bounce Back from Burnout will run for free, and that will be the last time in this format and with the free. So do join us. This is a great chance to go through this program with dozens of academics from all around the world and learn to keep yourself or come back to a state of well-being. What you need to do is only to apply. And for that, you can go to www.mindyourownrevisions.com/BBFB. So see you tomorrow for another tip. And until then, take care. Bye.